My name is Lucky Lovan, and I will be talking about Alzheimer's disease and the association with NFL football players. Today, 5.3 million people in the US are affected with Alzheimer's disease. Due to Alzheimer's disease being strongly associated with older age, it is certain that the dementing disorder will threaten the elderly and public health systems. It is critical to further investigate the question: is the prevalence of Alzheimer's disease higher in NFL football players than NFL participants aged 40 to 75? Alzheimer's disease is a degenerative brain disease and the most common cause of dementia. In Alzheimer's disease, the damage and destruction of the neuron ultimately affects other parts of the brain that allows a person to carry out basic bodily tasks such as walking and swallowing. The most common initial symptom is gradually worsening ability to remember new information. Mild cognitive impairment is a construct commonly used to define groups of people who may be at risk for developing dementia, which are critical for targeting preventive interventions. Dementia can be distinguished by a deterioration in memory, language, problem solving, and other cognitive skills that affects a person's ability a, to carry out daily tasks. The deterioration is damage due to neurons and parts of the brain that control cognitive function. Depression can be clinically diagnosed several years ahead of Alzheimer's disease, which explains the comorbidity of subgroup of patients with Alzheimer's disease depression later developing of Alzheimer's disease. Sport-related traumatic brain injuries is an urgent public health care concern classified as a silent epidemic. Retired professional football players were more likely to have a progressive decline in mental health function, higher rate of memory problems, and cognitive associated with a history of concussions. There is no association between previous concussions and lifetime onset of Alzheimer's disease. The cumulative effects of subconcussive and concussive blows to the head sustained by professional football players may promote an earlier progression of Alzheimer's disease, which age factor overpowers this and prevents it from becoming an independent predictor of lifetime onset of Alzheimer's disease. A cause and effect conclusion cannot be made by looking at one population group. Despite limitations, the data suggests that a history of recurrent concussions and subconcussive context to the head may be a risk factor for the expression of late life memory impairment. Depression is the most psychological disturbance after TBI, with prevalence rates from 6% in mild traumatic brain injury to 77% in more severe TBI within the first year after injury. Retired football players who have a history of concussion and depressive symptoms report an increase in physical limit that hindered their ability to perform daily physical tasks, such as compared with those without depression. TBI is a major cause of acquired disability worldwide to young adults. Falls are the main cause of TBI for older adults, and motor vehicle crashes are second. In non-sport related concussions, most individuals recover completely within the first 3 months, although up to 30% may display symptoms beyond that. It was found that there was a higher prevalence rate of Alzheimer's disease in NFL players than non-NFL players. As a future physical therapist, being able to understand the magnitude of concussions on an athlete and the general population will allow me to work more diligently to provide the best care for my patients. Being aware of the prompt progressions of exercise prescription for specific post-concussion symptoms, I will be able to provide a foundation to guide my patients through a successful treatment intervention. Thank you so much for watching this video. If you have any other questions, please let me know.